Ultrasound of a 65 years of female with a history of epigastric pains with and has been referred to rule out the cause. This is the liver in front of you with portal vein and the common bile duct. Intentionally showing you this is the portal vein, this is the common bile duct, not dilated. If I can get the gallbladder from this angle in a beautiful pic, that is, I mean, if you see here, the actually the gallbladder, this is the gallbladder, and you see that the wall is thick and the lumen is studded with multiple tiny echogenic particles, giving few of them giving shadows. These are minor portal vein radicals which are prominent, and this is small amount of fluid around in the Morrison's pouch, and so thick wall gallbladder, diffuse decreased parenchymal echogenicity of the liver that is evident by these minor portal vein radicals. They are normally not seen, but here we can see them clearly. So this is the gallbladder from here to here, with all these with fluid in the Morrison's pouch. Now when I move the probe in the epigastric region, I see that there is fluid. This is fluid in the lesser sac and as well as in the Morrison's pouch. This is the pancreas, and you can see that the pancreas, the peripancreatic area shows irregularity. This one, the contour of the pancreas is normal, but the outer surface is a bit irregular. And this is the splenic vein, yes, the splenic vein, the superior mesenteric vein, the superior mesenteric artery, the aorta, and this pancreas is gives you diffuse decreased parenchymal echogenicity is seen because of pancreatitis. I do not have any lab profile available, but when you don't have any profile, then we have to work like this. This is the head of the pancreas, measuring approximately 21.5 is large. This is the body of the pancreas in transverse section, measuring 19.1. This is the tail of the pancreas. It measures 2.1. So all dimensions are raised. The echogenicity is diffusely decreased. Internal tiny echogenic particles are seen. These few particles, echogenic, is suggestive of chronic pancreatitis rather. So maybe an acute episode. This finding is, I think, reactive to the gallbladder pathology, because gallbladder pathology leads to such situations. However, if we consider the gallbladder as the pancreas only, you can see small cystic areas within it. So this is an obstructive form of the pancreatitis. This is, you see, cystic area. This is a cystic area. This is a cystic area. So this is seen more. These cystic areas are seen more in the region of the tail of the pancreas. This is the tail of the pancreas. This is the splenic vein as a landmark for the identification of the pancreas. Now, why there is fluid here? You see, this is fluid. This is fluid. Then this fluid here is the pancreas. If you see concentrated, that shows tiny echogenic particles within the body of the pancreas as well. Here, this one, this. So this is pancreatitis, and again you see fluid. This is the tail of the pancreas, and this is the fluid. So this is pancreatitis of obstructive nature, and the cause is the gallbladder. Most probably the gallbladder has led it to its form. Now this is the pancreatic duct, if you see this one. So pancreatic duct is not dilated. These cystic areas you can see can be seen at the head of the pancreas, body of the pancreas, and the tail of the pancreas. Tail of the pancreas. All these areas show. Now this is the head of the pancreas. In longitudinal section, this is the head of the pancreas in longitudinal section. Okay, not only this, you will see fluid in the dependent region peritoneal cavity. Here. This is the urinary bladder, and this is all fluid with bowels floating. This is the fluid. Here. Urinary bladder, fluid, and these are the bowels floating with them. On the left side, you will see pleural effusion. This is the spleen, normal inside, and this is all fluid in the left pleural space. This is not only in the left pleural space, the fluid is also seen in the right pleural space as well. So bilateral pleural effusion is minimal on the right side, but minimal to moderate on the left side. सांस नहीं लगी। हाँ। You see this is fluid. सांस लेना। Hepatic veins are normal, as you can see. This is the portal vein, normal, patent. So this is a case of hemorrhagic pancreatitis with gallbladder, thick gallbladder wall and calculi with an decreased gallbladder is collapsed almost, and you need a very sharp eye to see this. This is the gallbladder, and this is a tiny calculus giving posterior shadow. So this is our case of the day, and that shows us well, this is a case of our day, that is relating to the pancreas. Number one, hemorrhagic pancreatitis with chronic cholecystitis with cholecystitis and bilateral pleural effusion. There is no intrahepatic bile duct ectasia seen. Thank you very much.